Welcome to the show, Brain Health, Unchaining Your Pain. I am delighted and really honoured to welcome onto the show today Dr Leo Galland, MD, who is just a phenomenal force for good in the space of integrated medicine. Welcome to the show, Dr Leo.
So nice to be here with you.
So for those that don't know Dr Leo Galland, he specialises in the evaluation and treatment of patients of all ages with complex chronic disorders. He views the relationship between the doctor and the patient as a partnership that empowers people to take control of their own health. He's a pioneer in studying the impact of intestinal microbes, which is the gut microbiome, and intestinal permeability, which is leaky gut, on health and disease. He's received international recognition for developing innovative nutritional therapies to treat autoimmune, inflammatory, allergic, infectious and gastrointestinal disorders, and has been had his work described in numerous scientific articles and textbook chapters. He's graduate of Harvard University and New York University School of Medicine, board certified in internal medicine and listed in leading physicians of the world and America's top doctors. And in 2017, Dr. Galland was awarded the Albert Nelson Marquis Lifetime Achievement Award by Marquis Who's Who. Wow, what an amazing accomplishment. And also, I'm so grateful for the work that you do, particularly in the realm of the situation that we are now in, which is COVID. And I've absolutely your source of information on your website has been a powerhouse of information for myself, and also helping my clients better understand how they can recover from COVID. But before we dive into that topic, I'd love if you could describe what you are truly passionate about right now.
Well, for the past 2 years, I've been dealing with and trying to help my patients deal with COVID-19 and trying to understand the nature of the virus, the human response to the virus, all of the many different aspects of this pandemic as it affects our lives. That's kind of been all consuming.
Yeah, I can imagine. And it's impacted people in so many different ways, depending on their genetic construct as well as their lifestyle interactions that they have with the environment, and obviously how they are from a immune system perspective. What for you has been the most notable problem or biggest challenge in the context of COVID that we're experiencing now?
Well, the biggest challenge has been, especially in the US, the politicization of the science. Mm-hmm. And it's really been mind-boggling the way that sides have been taken. Mm-hmm. And part of my goal has always been to try and really understand the science, be flexible. Certainly in medical practice, my goal has always been to be patient-centered, to try and understand what are the needs of this individual rather than what construct am I trying to impose on the individual. And that has really guided what I've tried to do in dealing with COVID-19. And it's been very distressing to me to see the way that the science has gotten used for political purposes.
Rather than actually focusing on helping improve the outcome of the individual, right, which is really what we're talking about, isn't it? From the context of COVID.
Absolutely.
And I think, for me personally, I came across your work. Obviously, I'm based in the UK, when I was lying in bed, wondering how to get myself out of the state I was in, having contracted COVID from my daughter, most likely because it was picked up through nursery, and thinking, gosh, I think I've done everything that I possibly could from a intervention perspective myself personally. As a certified brain health professional, what am I not doing? And how can I help myself get better? and I came across the amazing summary of all the science and all the interventions that you've put on your website, which was like your COVID Bible of steps people need to take, and the lovely videos that you've done, and watched them again and again and again, to embed that information in and take the appropriate steps to help me recover. And what I was really shocked, obviously, from getting COVID was how quickly it can consume you. As you know, as an individual, you think you're just getting a little bit of energy. I started off with muscle aches and pains, and quickly lost my energy completely, and then subsequently developed a cough. My daughter Lily, who's 3, she didn't really present any symptoms other than having nightmares, which could have been due to COVID itself, possibly, but also could be due to the trauma she was witnessing of mummy being poorly in bed. And I just thought, how can we? And she got a cough too, and we dealt with it through the recommendations that you put forward, and I am fully recovered in about 4 weeks, which was amazing. You know, I was really thankful for. So really, thank you from the bottom of my heart there. But what I really was shocked by was the number of people who are still struggling with COVID 6 months, 12 months, 2 years on. And I know that there was a recent study that came out here in the UK about the outcome of people hasn't significantly improved over a 2-year period, based on them being hospitalised. But however, there was no intervention taken by the medical community to facilitate the people improving their outcome. And that's what I'd really love to talk about today, because I know it really, you know, in terms of unchaining people's pain, we're not just talking about the pain here and now. It's such a long, slow burn that is being experienced, both from a, you know, obviously yourself being incredibly busy in the medical space, but people actually not getting better in the way that they can get better through interventions that doesn't necessarily require drug use.
Right. Well, some of the studies that have been done in the UK are particularly alarming, and also illustrate the nature of the problem we're dealing with, because people who have mild COVID may have persisting cognitive deficits that can last for months and months, 1 or 2 years. There are changes in the MRIs of the brain that actually match those cognitive deficits. It's the same areas that line up. So these are not the MRI changes. And I think this was a really, really important study where repeat MRIs were done in people who had COVID and who had MRIs just before the onset of the pandemic. And there was a control group of people who didn't get COVID. And there were changes in the brain, loss of actual brain matter on MRIs in the people who had COVID. And these were not people who had been hospitalized. They hadn't been very sick. And then another UK study which looked at cognitive changes in people who had COVID. And there were cognitive dysfunctions, and they really lined up. They matched up with the MRI changes. So these are very significant. And there was a relationship between the nerve tracts that are involved in taste and smell. So it's pretty clear from this set of research that the virus has access to the brain through the nose and can cause inflammation and other types of damage there that really impact on people's lives for a long period of time. Helping to restore and protect the brain in people who have acute COVID, I think really needs to be a priority. It certainly has been in my practice.
Yeah, and I totally agree. And I think it's something that people, you know, I'm constantly coming across people who are experiencing brain fog. They're struggling with their energy levels. They can't get themselves back in focus. or they've got an enhanced level of symptoms that they previously had from a mental health perspective, such as, increased symptoms of depression, excuse me, which they didn't have before COVID. And, there may be a relationship between people catching COVID and the number of suicides that are being experienced, because people who are in a depressive state go into a deep depression, and that then obviously tips them into the final resort to help them unchain their pain, which obviously is a permanent solution. I'm really curious, because I'd love to really dive into this brain health issue from a COVID perspective. From your standpoint, from your experience in the work that you do, what is optimal brain health for you personally?
Well, okay, for me personally, it's the ability to think through problems. And I would say, actually, from a societal perspective, problem solving is what we as a species need in order to continue to survive and to thrive. And that means being able to identify what the problems are, what are the obstacles, and then to come up with plans. Certainly in terms of my medical practice, I would say that's been the approach that I've taken for decades, is to try and identify or look for those problems that are not being solved and try to figure out, okay, is there a rational way to solve them? I remember reading an article, it was actually in The Lancet, the leading British medical journal, probably 30 or 40 years ago. It was an analysis of medical education, and it maybe it was an editorial, and it said, big problem in medical school is that students are not taught how to solve problems. And I really think that is the most important mental quality that needs to be fostered.
Do you know, I love that. I can really relate to that as well, because I'm a physicist by background, and so my goal is why, and I have always defaulted to the need to understand what the problem is and solve it. And I think, the way we sometimes approach a problem is we look for a symptom. We take a symptom focus and address the symptom, but don't understand what the root cause of the problem is. So doing root cause analysis, which is, I love what you do, is you keep going in your work until you find where the root of the problem is. It's like taking a roof and you've got loads and loads of holes in your roof, and it keeps leaking. There's no good patching it up if you're constantly got somebody who's going around and punching holes in the roof again. You have to address the person that's making the holes in the roof and causing it to leak, not just the leak itself.
Actually, for a house analogy, I began feeling about 40 years ago that what I was doing in working with patients was going into the basement and and where it was very dark, and where all the specialists that they'd seen hadn't gone. They were just tinkering with the upper floors. And so I was going into the basement with a lantern, and I was kind of looking around. Oh, here's where the problems lie. Let's get down to the foundations of things.
Yeah, and I think that's so important. What is it you're really noticing in terms of, I know you talk about this a lot on your website, but common symptoms that people present with, and I know there's over 50, but the common ones that people present with, which tends to indicate that they are experiencing long COVID that perhaps they haven't had previously, or have worsened.
There, almost anything could be a symptom of long COVID. And there are also aspects of long COVID that are not even symptomatic. That is, someone who's had COVID-19 has twice the risk of being diagnosed with diabetes or high blood pressure over the subsequent 6 months compared to someone, a matched person who has not had COVID. But the particular things that I look for with my patients when I've treated them is this issue of brain fog. Like, how's your brain working? How well are you able to solve problems, to think things through, to think, to understand what's going on that you need to address? How's your memory doing and your ability to focus? Those are very important issues, and I want to make sure that every patient of mine who has experienced COVID-19 is able to tell me, within a month or 6 weeks of the infection, I feel really back to normal. My mind's working fine. The second thing is physical energy, stamina, your ability to do the things that you used to do and that you want to do. And of course, that can get hammered just by the fact that you've been in bed for a week or two. I mean, if a person's been really sick, just cutting back, you have to build up slowly. It's the people who cannot build up slowly without crashing that really concern me, because that's one of the hallmarks of chronic fatigue, ME, basically, is that you try doing things to condition yourself, and instead of getting stronger and stronger, you actually pay a heavy price for that. So that's something that I really look out for. Then there's the issue of breathlessness. So the question are the limitations on your activity related to breathlessness and just feeling a need for air that you're not getting? Then there's pain, and of course there are emotional changes as well. And there it's always challenging to try and determine how much of this is the trauma of what you just went through, and not just you personally, but that the whole society is
the whole system that's been impacted.
The whole, because if you today, if you get a sore throat and a fever, 2 years ago, you got a sore throat and a fever. It was okay. Well, I got something. I'll get over it. Today, in the face of the pandemic, you get a sore throat and a fever, and it's kind of terrifying because you don't know where it's going to end. What's going to happen next?
And then there's the impact of your immediate family or the wider system.
Who am I going to spread this to? And the isolation and the quarantines. It's very traumatic for all of us.
And I think what's really difficult as well is the fact that this is not a once infection. People I know who have had kids that have been infected twice, going into 3 times. So it's not just this happens once and then you go through the recovery phase that can be enduring, but it's also that you could be going through this multiple times.
Yeah, absolutely. I have patients who have had 2 or 3 bouts of COVID and not even very far apart. I mean, people got the Delta variant in August, and then in December they got Omicron. The one thing is that if you've had it before, or if you've been vaccinated, it's going to be less severe. And almost everybody who's had it more than once said, oh, the second time, it was so much easier than the first.
I love some of the studies that you brought up, and I particularly love the one that they did in America with medical professionals, where they studied the vegetable intake before before COVID and after recovery.
That's a really important study. And although the researchers were in the US, they looked at healthcare workers in 6 different countries, including the UK. And it was a fairly large study, and it really used validated tools to assess the severity of infection and the pre-illness diet. And the results were just so dramatic. As I've said when I've spoken about this, if this were a drug that did this, imagine the headlines.
Yeah, I mean,
you'd
he
see.
quoted a 72% reduction in the risk of developing moderate to severe disease.
Yeah, right. With
a 40% increase in vegetable consumption.
and it wasn't even a huge number of vegetables. It was people.
No.
It was an average of going from an average of 10 servings a week to 15 servings a week.
Yeah.
That's all it took to
Which is
create that
amazing.
change. Yeah.
And what I find, I don't know if you're experiencing this your side of the pond, but I find it amazing that people aren't educating people more in the benefits of increasing their uptake, at a global level, or a national level, or a community level, how powerful a simple uptake in your vegetable consumption. And we know food is medicine.
Yes.
The best form of medicine, often from a preventative perspective, certainly. And if we don't focus on our food and optimizing it to optimize our immune system and our gut function and everything that falls out of that optimization or absence of, then we end up deferring what could be a very acute problem into a much bigger problem over the long term as well.
What really is really disturbing to me is the way that the mainstream media has actively worked to discredit the idea that anything you yourself do can protect you against COVID. It is so that vitamin D, for example,
So
really
important.
has been shown to have protective effects. Yet article after article in the mainstream media will say, oh, vitamin D doesn't really protect you against COVID. Don't think you're not going to get sick if you take vitamin D. And there is this attitude that the only thing that is going to save you from COVID is what the doctors do to you. And that there's nothing you can do yourself that is going to help you. And
almost the converse is true. There are so many things that we can do at an individual level that have the opportunity to improve our outcome. And actually, yes, taking the antiviral drugs that are necessary, the vaccinations, are really important, but they don't stop you from getting it, and they certainly are not going to stop you from developing long COVID either.
Right. It's there clearly is value to the vaccines in that they allow huge numbers of people to develop an immune memory of this virus without having to go through the infection itself.
Yeah.
And the benefits of that, I think, from a societal perspective and an individual perspective, have been very clear. On the other hand, as you pointed out, it's not stopping the transmission of the virus, and there is so much more to be done than simply vaccinating and separating. Kind of stay away from everyone. I'm going to vaccinate.
That's not going to. So we have to learn to live with it.
Yes, and that involves self-care and understanding what it takes. How you can maintain your health in the face of threats like this.
And I know that you go through this 5-phase approach. Would you mind kind of outlining? And I will put the link to your COVID handbook on the show notes. Would you mind outlining the sort of 5-phase approach that is really important for people to take?
Well, okay. Well, it's constantly evolving, first of all. So I don't even know if there are really 5 phases right now. It's not really formulaic, but the first principle for me is understanding that one of the ways in which this virus makes you sick is that it enters your cells by binding to a receptor, which happens to be a vitally important enzyme called ACE2.
ACE2. I like to think of this as the key in the lock to your cells. So it basically makes itself look like the key, and the lock is ACE2, and as soon as it goes in, it destroys the door into your cell and everything associated inside it. Like it breaches the castle walls, but goes through the front door.
Right, and so the loss of ACE2 because of the virus is one of the important factors in creating not only the complications of acute infection, but also long COVID. So the foundation for everything that I've done in trying to help people confront COVID-19 is to strengthen and support the activity of ACE2. And that's true whether you're trying to prevent serious infection, treat infection when it occurs, and certainly important when dealing with long COVID, because there are studies that have shown that even relatively healthy people who have recovered from COVID-19 have deficits in the functions that ACE2 regulates, if you know how to look for them and measure them. Problems in circulatory function in healthy young adults. So I want to restore ACE2 activity. And
it can be depleted as well, can't it? Obviously, depending on your lifestyle, depending on existing conditions you had. One of the things that you mentioned was asthma. Already have a depletion. People suffering with asthma already have a depletion of ACE2. Is that?
That's correct. And actually, having asthma is one of the leading risk factors for long COVID. In a recent study, people with asthma had a 9-fold increase in the risk of developing long COVID. And I think it's because they start out with ACE2 that's compromised to begin with. So there are lifestyle and dietary and nutritional measures that can enhance ACE2 activity. Certainly diet has an impact, especially the foods that are rich in polyphenols and bioflavonoids enhance ACE2 activity.
Basically.
Curcumin, resveratrol, taking the supplements. Vitamin D is very important there. So I start with that as a foundation. Let's help to bring back ACE2. Now, damage to ACE2 has been shown by research that was done at the Scripps Institute in the US to result in stress to mitochondria. Mitochondria are the powerhouses that generate energy for cells. And so the next layer is to support mitochondrial function. And there are no drugs that do that. There are some supplements.
Think is so important that people realize that the drugs are not available, and it's supplementation and appropriate dietary intervention and lifestyle intervention that restores your energy powerhouses in your cells. And I'm assuming that the energy depletion that people experience is a consequence of your mitochondria not having the powerhouse functioning fully. That's okay? Is that right from a
mitochondrial? Definitely. And
so
and there are specific
if people are feeling really
supplements.
depleted energetically, it's because their mitochondria have been compromised, and so really they need to focus on the steps that are necessary to enhance their mitochondrial function and restore the energy powerhouses in their cells.
Mitochondria play an important role not only in physical energy but in brain energy. And in the the energy of the immune system. You know, the cells of the immune system require a lot of energy to function well. So that mitochondrial support is important for immune function, brain function, and physical energy and stamina. So that's a second layer to the foundation is mitochondrial support. Coenzyme Q10, carnitine are helpful as supplements. And carnitine also supports the function and development of the energy lymphocytes that are necessary for remembering how you fight this virus.
Which is really important too. So your soldiers that that know how to fight the fight, you want to make sure that they're equipped with the with the iPads or the memory systems so that they know how to do it again and again.
Yes, right. So those are two things that are really fundamental. And then there are many different physiologic functions that are thrown awry by the loss of ACE2 and the impairment of mitochondrial function. And I'm working on a diagram that I call the web of long COVID, because from the center where you have the ACE2 and mitochondrial dysfunction, there are all these filaments
Branches.
that go out, and they all interconnect with one another.
Yeah.
And they impact circulatory function and blood clotting, and various aspects of immune function. And there's more and more research showing, different research labs they'll look at this and they'll look at that aspect.
But not the integrated.
Right. And so what I try to do is to look at how all of these things are related to one another. And therefore, what can you do about it?
What I find fascinating about the work you do with all of your background experience in immune system and immune system function is the importance of optimizing our gut health to restore our immune system, and the fact that the virus can really stay in our guts beyond us actually recovering, removing it from our system outside our gut, as you will. So we may not experience the sort of immediate symptoms, but actually that virus staying in our gut can contribute to the long COVID symptoms that we experience.
Right. We don't at this point know if persistence of the virus in the GI tract, as opposed to other places, plays an important role in long COVID. There is a fair amount of research indicating that, at least for some people with long COVID, viral persistence is a factor. And the virus has been found in organs all over the body. But we do know that it persists in the GI tract after it leaves the respiratory tract. And we do know that there are major disturbances in the microbiome in the GI tract, in the mouth, and in the stool, as measured in stool specimens, even in the nose, that play an important role with COVID. Before the pandemic, a lot of my focus was on the impact of the gut microbiome on inflammatory disorders, immune function, brain function, health in general. And that actually has wound up being very relevant to the problem of COVID-19 and of long COVID. There are distinct patterns of gut microbes that are associated with protection or an aggravation of the conditions.
Which I don't think is really brought to the fore as much as it needs to be, from how can we help people from an integrated perspective, not just look at the fact that we need to address the immediacy of the fact that there's a virus in your system, but address the fact that how can we help the different systems in our body effectively recover, and what steps can we take from an integrated standpoint to boost our overall function. And I think the gut, often people forget that there's a gut-brain connection through the vagus nerve. So it's absolutely vital, if we want to restore brain function, that we also focus on how can we restore our gut function and our gut microbiome, and optimize that so that we are best placed to facilitate improvement in our brain health as well.
Right. I think there are actually probably 4 different levels in which the gut microbiome impacts on COVID-19. The first is that the severity of infection, when you get infected, is influenced by what's growing in your GI tract and in your mouth as well. And that's been studied. There are anti-inflammatory bacteria that appear to be protective. The second is the potential use of probiotics and prebiotics for actually treating the infection. And there's a randomized clinical trial from Spain that used a particular probiotic formula and showed a really significant impact on the outcome of acute infection. The third is the influence of gut microbes on the persistence of symptoms and the development of symptoms consistent with long COVID. And this has been established both for gut bacteria and also for oral bacteria. And it seems to be very much the same pattern. Are these bacteria organisms that tend to create an inflammatory state in the body, or that tend to turn down inflammation? And then the fourth use is in actually treating the symptoms of long COVID. And that makes sense for the GI symptoms, but there's a definite impact on the brain as well. And it even goes beyond the vagus nerve. Gut bacteria produce metabolic end products called short chain fatty acids that impact brain health. And one of these, probably the most important, butyrate, actually has been shown to help the brain recover from injury. It's anti-inflammatory, not only in the GI tract, but systemically. It is volatile. It gets readily into the brain. It stimulates the formation of a protective factor called BDNF, which helps the brain repair damaged neurons.
Yeah. And what steps can people actually take themselves personally to help boost their gut microbiome in the context of contracting COVID? What are the sort of simple interventions people themselves can take to help enhance their gut microbiome?
Okay, well, first of all, there's diet. And a diet that is high in vegetables and high in fiber. That helps support the growth of the kind of bacteria that we want. In addition, herbs and spices, colorful fruits and vegetables that are rich in bioflavonoids. The flavonoids I view them as curating the microbiome, and they guide the growth of of specific organisms and types of organisms that we want. And these organisms actually enhance the bioavailability of these flavonoids into our bodies. Then there are probiotic supplements, and I don't think that there's any one probiotic that's ideal for everybody. There actually is a pattern of probiotics that I recommend for prevention, treatment, and recovery, and they're different at different stages.
Yeah.
And I don't want to go into the details because they may not be available in the UK, for example. And then there are prebiotics. And I think that prebiotics, especially galacto-oligosaccharides, which are present in human milk, but are also available as supplements, play a very important role as prebiotics.
And you can get, there's a prebiotic that you can get that contains that, is available globally, and I'm happy to put the link to that. That's derived from
I think it's an excellent. I think that's an excellent source.
Yeah.
And also, I think it's important to use caution with antibiotics.
Yes.
And I think that there has been, in certain circles, an excessive use of antibiotics in attempting to treat COVID-19. And I like to really target the use of antibiotics at organisms that I know are going to respond to antibiotics, and not just use them in a broad way when somebody has a viral infection.
And the risk, of course, with antibiotics is it can wipe out the good bugs in your gut, as well as the bugs that it may be seeking to treat, which actually can be detrimental potentially over the long term. And it takes a long time for people to restore their gut health. Certainly from my experience with my daughter Lily, who was born by C-section, she was on antibiotics early on in her life because she kept on getting chest infections, and actually we moved to probiotics for her, and she hasn't had a problem with that since, putting her on a prebiotic, for her, to help boost her immune system and gut function, because obviously she wasn't bathed in all the bugs that you normally would through a vaginal birth, which helps you build your immune system. Are you noticing that there is a difference in terms of people who contract it, or a greater severity depending on their history, in terms of treatment or coughs or colds or flu, that people are more vulnerable to contracting COVID?
It's hard to say about vulnerability of contracting it, because right now with Omicron,
anybody,
everybody's getting it. This is so highly transmissible.
Yeah.
In terms of severity, definitely underlying health problems impact on the severity of the illness. And aside from the ones that have been established, like obesity, diabetes, hypertension, are major risk factors for more severe disease. In my practice, I have a very specific group of problems that people come to me with. They're mostly immune problems, autoimmune disorders, chronic infections, allergies, and so many of those individuals are prone to the complications that can occur with COVID-19. And I view my role as to try and help them not only get over the acute infection as quickly as possible, but to prevent the aggravation of their underlying problems by the inflammation that occurs.
Yeah, and I think that's so important. I'd love to just dive quickly. I know we're a bit short of time, but I'd love to dive quickly into children, and helping children from a recovery perspective with COVID, because a lot of the focus has been on adults and adult interventions. But what would your advice be to parents who have children who are really struggling with COVID from a health perspective? Or I mean, we haven't even talked about it, but from a psychological perspective is a huge problem.
Yeah, I think from a psychological perspective, it really depends on the age of the child as to how they're likely to be impacted. And I think the children just have to understand that people get sick, people get well, that's part of life. I think you can encourage children to be willing to take care, to eat well, and take medication in the form of natural products.
And I know
as a way of being strong and healthy.
Yeah, I know for me personally, our big focus when Lily had COVID was to make sure we gave her as many vegetables as possible, and obviously multiple coloured fruit and veg to boost her system. But also we added vitamin D, omega-3, and a multivitamin supplement,
Right.
which was enough. But I know you mentioned when we first connected is perhaps zinc. Could be another, and vitamin C, but at the right dose that's appropriate for your child's age.
A lot of kids need zinc because you need zinc for growth, and many of the diets are not adequate in zinc. So and there are liquid zinc preparations that are quite palatable and easy to include. Omega-3s have been shown to be beneficial and decrease the inflammation. I give a lot of the children that I treat a liposomal liquid of curcumin and resveratrol, which is tastes pretty good and is easy to get compliance with.
Oh, that's great. I didn't manage to get her to be compliant with taking any turmeric or resveratrol.
But I think children as young as 2 years old can understand that that eating, if you eat these foods that are healthy foods, that you'll be strong. They understand strength. Oh yeah, I'll be strong. I'll be able to run.
Yeah, and I tell my daughter,
swim.
I want to build your immune system soldiers and make them strong so they can fight the infection. So you're right, they do get it.
Yeah, they understand strength.
What would your one piece of advice be for anyone who's really struggling with long COVID? What would your advice be for them?
Well, first of all, rest seems to be important. So start by making sure you have enough rest, physical rest, mental rest, and sleep. That really is, that's critical. If you don't do that, it's going to be very hard to get anywhere with all of the medications, the supplements, and the other treatment approaches.
And I think that's so important, because that's the foundation piece for me. Is the most important thing from a brain health perspective is you have to optimize your sleep, because if you haven't got that foundation there, it doesn't matter what else you do, your brain isn't fully functioning to be able to take on the day. How can we get hold of you, Dr. Leo Galland, to people to find out more? We'll post all of the information in the notes, but what's the best way?
Well, I have a website, drgalland.com. It's drgalland.com, where I post information, and I've put up some videos on Vimeo and YouTube about long COVID, your brain after long COVID, healing long COVID, understanding long COVID. I'll continue to be posting that information. This is such a fast-moving area that you put something up 1 month, and a month later there's more information. It's not that what you've already put out there has become obsolete. It's just that there's new information that expands, deepens, and broadens the vision.
Yeah, and I just really appreciate you for doing that work and taking the time to dig into the research and bring to the fore what people need to be reading and learning and implementing at a medical professional perspective, and also an individual perspective, to help people really take back control of their well-being and facilitate their recovery from COVID. And I know that your 2 books that I have here, which is the fat resistant diet and also super immunity for kids, have been absolutely brilliant Bibles for me as a parent to make sure that I can do everything appropriate to support my daughter's health and well-being and optimize her immune system. So just thank you from the bottom of my heart in all that you do, and thank you for your time being on the show.
Okay, well, thanks for giving me the opportunity to share my experience with your viewers.
You're most welcome, and I look forward to connecting with you in the future.
Okay, absolutely.
I really hope you enjoyed that conversation. Thank you so much for listening. Please be sure to like and share this episode and leave a review on my website or on Apple Podcasts. If you're looking for opportunities to optimize your brain health or unchain your pain from a past trauma, make sure you visit my website www.ruthmaryallen.com and use the code podcast10 at checkout to get 10% off all programs. And always remember, you are not stuck with the brain you have. You have the power to make it better. You have the power to unchain your pain and optimize your brain power and performance so that you can win back energy and time doing what you love.
episode of Brain Health Unchaining Your Pain with Dr. Ruth Allan is for educational and demonstration purposes only. The information shared in each episode should not be interpreted as medical advice. This episode should not be used to self-diagnose or self-treat any health, medical or physical condition. Do not use this episode to avoid going to your healthcare professional or to replace the advice they give you. Consult with a trusted healthcare professional before doing anything contained in this episode. If you have any questions or concerns, please contact www.ruthmaryallen.com/connect.